Good morning, everyone. Thank you for joining us for the third quarter health huddle. And with me today, I've got my fabulous partner, EBC, Clarissa Messenger. Plus, since it is, guys, it's based on annual enrollments, we brought in our experts whenever it comes to y'all doing your open enrollments. So I have Megan West, who is the EBS for the Northwest, and Haley Gajewski. She is the specialist for the East. All right. I knew I was going to mess it up. So, everyone, we are going to try and make this interactive and fun, maybe something that you can enjoy and remember. So, we are going to play a Kahoot game. And so, we're going to get that pulled up for you. So you can start getting logged in. So there is, you can either type in, once you enter in the Kahoot, you can enter it in by the game pin, or you can use the QR code. So if y'all will start getting signed in, we'll get ready to start playing.
And you can do this with your web browser or your phone. So if you want to still see the webinar, and do it via your phone, then you can scan with the QR code, or you can go through your web browser as well. Looks like we've got a few logging on. Yay!
Yes.
And there will be prizes, so you want to make sure that you're participating. So get in there, get your name in there, and make sure that we, at the end, will ask if there's a nickname so that we make sure we get you a prize if you're on the podium board. It's going to be a fun theme. Perfect for summer and annual enrollment. We're excited. All right.
Okay, and we've got how many?
57 people
57.
on the webinar.
Okay.
I think we'll wait a little.
Just a little bit longer because we don't have a whole lot.
And for any TAC folks on the webinar, you can't
You cannot play.
Because we're not giving you a prize. It looks like we still have a lot more coming in, so we're going to wait a few minutes. And the PIN number is 510100. I see that in the chat box for Christina. 510100. All right, we've got lots of people. 27 people, 60 participants on the webinar, so just make sure that you get logged in. Looks like it's going.
Yeah, we're almost halfway there.
Give y'all a few more minutes. All right. What do you think?
And if you're having an issue, please put it in the chat box of the team meeting so we can monitor that. Also, if you have any questions throughout this game or presentation, we're watching it. We hope to answer all of your questions, but put it in there so we'll know if there's any misinformation floating around out there.
And don't forget, we've got our EBSs here, so they're going to be able to help with any questions related to OASIS as we talk about annual enrollment.
Okay.
All right, I think we'll get started.
Yeah, we'll go ahead and get started. So what we're going to be doing today, with it being annual enrollment, and so we know y'all stress out whenever it comes to annual enrollment, so it's stay cool, stay in control. Annual enrollment starts with you. So, how to play. It's typical Kahoot game. You've logged on, enter the PIN number. You're going to be answering questions throughout the presentation. And like Clarissa said, top 3 participants, we've got prizes for you that we will get out to you. Okay, so we're going to do a quick little icebreaker to get you ready and prepared. So first question is, how ready do you feel about annual enrollment meetings for the upcoming plan year? And just put how you feel in there. There's not a wrong answer. There's not a right answer.
We want to feel the temperature.
Okay, almost done. Okay.
Oh, nice.
That's really good because we do start getting questions already, just about what you need to do and all of that, and so we want to make sure y'all do stay in that cool as a cucumber role and not a hot mess. So the next one, what is the main goal of annual enrollment? And I'm sure some of y'all do feel like changing your office hours during this time period.
Or planning a party.
All right, good.
Okay, only one said planning a party. I like it.
All right, so far we have Rebecca, JJ, and MC. Guys, remember, if you just put your initials in, if you're on that leaderboard at the end, we're going to need your name and the county you're with, so we'll know who to send the prizes to.
And don't forget that as you go through and answer questions, the faster that you answer, the more points that you'll get. And of course, if it's right or wrong, there's going to be some questions that have a right answer, and then some that are just poll questions where we want to get a feel of what you feel out there. So now we're going to play another fun game called Let's Play Cool or Hot Mess for Annual Enrollment Best Practices. All right, quiz time. So if I made changes to my benefit plan design, I should hold annual enrollment meetings. Yes, I want to hold those, so you're cool, or no, be a hot mess. See what we've got. All right, so most of y'all said yes, you want to hold those open enrollment meetings, or what we're now moving into calling those annual enrollment meetings. It's a great way to just remind employees of those benefit plan changes if you do have those this upcoming renewal season. All right, let's see who's on the leaderboard. JJ moved up, so this is ever going to be changing. All right, another quiz question. Lone Star County hasn't made plan changes or meetings in the last few years. Should they host presentations this year? So again, they haven't made plan changes and they haven't held annual enrollment meetings or presentations. What do you think? Should they be having that or not? Okay, cool. So 38 of y'all said yes. Awesome. That is a good recommendation if you are making those plan changes, or even if you're not making those plan changes and you haven't had annual enrollment meetings or opportunities for employees to come in and visit with some of your vendors that you have for different coverages. It's a great opportunity for employees to come in and ask questions if they have any. All right, Sharon is up on the leaderboard. All right, true or false? I should hand out resource guides to my employees at annual enrollment. So of course, these are those blue booklets we send out almost every year if there's changes. 35 of y'all said yes. This is a great tool, and Kathy's going to talk about how useful those resource guides are for your employees.
Okay, Sharon is still in the lead.
And I'm going to assume that's Sharon Dowda and not Sharon Cox or Sharon. So true or false, resource guides include copay amounts for office visits. True or false? Do they include those copays? See, I think we've got almost everyone submitted. All right, true. So 36 of y'all are correct. Those resource guides are going to include co-payment amounts, not just for primary care physicians, but it'll also include those amounts for specialty providers, urgent care clinics, ERs, just depending on the plan design for you. Oh no, Jennifer C came up. So We've got Jennifer, Desiree, and JAA. All right, so what information is not in the resource guide? Vendor contacts, co-pays, deductibles, or the lunch menu? All right, we made this one a little easy. So it would be the lunch menu. The lunch menu, in fact, is not going to be included in that resource guide. All right. JJ has a streak with 6 correct answers. Which is included in the resource guide? What do y'all think? So lots of resources in there.
Yeah.
Numerous. Right. Healthy County Wellness Program links and information. That is, in fact, true.
Okay, JJ is moving up on the board.
Sharon's still on the top 5 leaderboard, though.
Okay. A lot of y'all, whenever we go out to visits, everybody, ask us, whenever it comes to the resource guides, why do we send those out? Like Clarissa was talking about, it's a good resource for the employees to go back to look at their plan designs. And why we like to go over those is because the information is so useful, and if we point them to the resource guides, maybe they won't be coming to you with so many questions. But there's also information on the wellness program, if your county has like a county-specific incentive or something like that. All of that's going to be in the resource guide, and we always keep that resource guide updated. So if there's a change in legislation that's going to impact your care, if we are making changes to the actual benefits as far as how it's covered, that's going to be in there. Whenever you pass those resource guides out, if we're sending you new resource guides, get rid of your old ones. Do not pass out the old ones if you're getting new resource guides in. So like this year, everybody's getting new resource guides. Guys, seriously, toss those old ones away, burn them, do something with them. Because I literally had a group that they were passing out old resource guides, but since that resource guide went out, they implemented a dental plan. And in the resource guide that they were passing out, the dental plan information wasn't in there. And, a lot of people, sometimes that just doesn't click the importance of it.
And it's also just a really great tool to utilize during those annual enrollment meetings. So if we're out there, Kathy, an employee benefits consultant, myself, if we're out helping you with those annual enrollment meetings, this is oftentimes what we go over. So we do like to highlight the key pages, key points of the resource guide just to make sure that employees know where to find those resources. Along with that, a lot of the links for Healthy County are going to be included. So if they have questions about any of the different programs available through Healthy County, they do have a direct link into those resources. Yeah. So it's a great resource.
The other part of it is in the enrollment toolkits that you're receiving, that resource guide, the required forms and information that you're required to give to your employees each year, they're in that resource guide. So you don't need to always make copies of that toolkit if you're getting a new resource guide. All right, another question. If I get a lot of questions about the benefits throughout the year, I should host enrollment presentations or have tables. So true, false. And there's no right way to do an annual enrollment.
Right.
It's what works for you and your employees. So let's look. Jennifer C. is still in the lead. Okay.
All right, so as Kathy mentioned, there's no right way of hosting your annual enrollment. Sometimes the right fit for one county is not the right fit for another. But just keep in mind, ask yourself, should we hold annual enrollment presentations this year? We would recommend that you hold open enrollment or annual enrollment presentations if you make plan changes or any type of change to your benefits through the TAC Health and Employee Benefits pool. So if you are making a benefit design change, or if you're adding a product, or maybe you went a different vision plan route, then we definitely recommend that you host those presentations. If you're getting many questions from your employees throughout the year, maybe about the deductible, what applies to that, what applies to the out-of-pocket, what are your co-pays for office visits, then maybe it's time for a refresher for your employees. A lot of times when you're onboarding an employee, maybe that information is given to them, but there's so much that they're getting at that time that it's always good to just give employees an opportunity to have a refresher on their benefits. And then maybe asking yourself as well, if there's no plan changes, if I have a low frequency of questions throughout the year, it's up to you. Do you want to have annual enrollment presentations, or maybe that's an opportunity for you to have a different style of annual enrollment? So maybe not hosting presentations, but still giving employees the opportunity to come in and ask vendors questions. So you could always have vendors come in and just set up a table for that opportunity for your employees. All right, quiz time. So what should your employees do if you make plan changes? What do y'all think?
We're really trying to stump you with some of these questions, if you haven't noticed.
Who's gonna win? All right, so the correct answer to this one is to learn about the plan changes and make their elections. So if maybe you have a dual plan option out there that you're making tweaks and changes to, then you'll want to make sure that you're communicating that information out to your employees. Again, as I mentioned, if you're just making a vision change between plans, then of course your employees are going to want to know about that change. So it's good to make sure that you're informing them of that so that they can make those proper elections for the year. Right, on the leaderboard, let's see, Jennifer C. is still holding up. Okay, another quiz time. What is a benefit of annual enrollment presentations? Is it extra holidays, longer breaks, an employee refresh, or more paperwork? I know we like paperwork, but let's see what y'all pick. All right, a lot of y'all guessed that one correctly. As we talked about, annual enrollment is just a really good time for an employee refresh on their benefits, things that they have available to them as an employee of your county or county entity. So just having that opportunity for employees is important for them to learn about that information. Okay, Jennifer C.
And it says Sam is back in the game, gotten 3 in a row correct.
Right, another quiz. This is a multi-select. So, what is a sign of needing annual enrollment presentations? We've talked about this a little bit. What do y'all think? Remember, you can pick more than one answer. All right, so most of y'all said if employees have a lot of questions or if there's plan changes, that's probably a really good sign of you needing some annual enrollment presentations. Keep in mind that you can utilize your employee benefits consultant for these presentations for any of the products that you have with the TAC Health and Employee Benefits pool. We are happy to come out and present your benefits to your employees. So if you have any questions about that, feel free to reach out to your benefits consultant.
Yeah, and the other thing, you may not be getting questions, but whenever we do go out for an annual enrollment or something like that, some sort of a presentation, we may get questions from
Yeah.
employees that nobody knows they're having an issue, and so we always want to encourage the employees and the members to ask those questions because we want them getting the best benefit for what you're paying for.
Right, absolutely. All right, another question. Which is not a reason to host annual enrollment? You're planning a county parade, to answer questions, refresh information, or update benefit elections. What do you think, Kathy? That's a hard one, huh?
That one's good. Yeah, I'm stumped, guys.
All right, plan a county parade. That might not be the best time to be doing so at annual enrollment. I know y'all have lots of hats to wear, so that's a hard time.
All right, and Jennifer C., she's still at the top of the leaderboard.
Awesome. All right, another multi-select. So which event lets your employees ask vendor questions? Is it a team lunch, a movie night, a presentation from all vendors, or a come and go style day? What do you think? You can select more than one. All right, so a come and go style day and presentations from all vendors. And here in a minute, Kathy's going to talk about some different styles, and we'll give you some examples on different things that other counties are doing out there with their annual enrollment presentations.
All right. So looking at the leaderboard, Alan is now in the lead. All right.
Okay, another quiz time, multi-select. So, what is the benefit of come and go? A come and go style annual enrollment day. Is it to ask questions to different vendors, for employees not to have to go to work, for a free lunch, or let employees come on their own time? What do you think? All right, good job. Most of y'all guessed this one correctly. So it's a great opportunity for them to come in and ask questions to different vendors that you have, even those ancillary and supplemental insurance vendors. It's also a great opportunity for employees to be able to come in on their own time. Maybe they're super busy throughout the day and they don't have an opportunity to get away, but if that lunch hour is open or if they've got a 15-minute break in the afternoon, then it's a great opportunity for them to come in to ask questions to the vendor partners if needed.
Excuse me. Sorry, guys. All right.
All right. Alan is maintaining the leader on the scoreboard. So 3 participants have reached an answer streak of 14. So way to go.
All right. So should we have different time slots or a host to come and go? Like I said, there's not really a wrong way to handle or do an annual enrollment. Like Clarissa was saying, those come and goes, if a member has a specific question, they're going to want to reach out to us on an individual basis, because they, don't want everybody knowing what health issues they may be having. And so they're going to feel more comfortable coming up and talking to us, maybe in that type of a setting. But like Clarissa said, it's a scheduling, easier scheduling. So like sheriff's offices, we have a hard time being able to get dispatchers and jailers in because they all can't leave at one time. So, those come and goes are good opportunities. And then also presentations throughout the day. That's good, doing, multiple presentations throughout the day. There is no problem with us showing up out at a county barn at 7 o'clock in the morning if that's what's needed. We will also go to multiple locations within that day. So, we may do a couple of out with the road and bridge crews, offsite in their county barn, something like that. We'll go back, hold a couple of sessions at the courthouse. And then we can also do, if the sheriff's office, if they have a training room or something like that, we can go there and set up. We are flexible. We are here to meet your needs and how to do that. And then with the health fair, it's kind of like that come and go, but you're getting a whole big selection. Some of the health fairs that we have up in the Northwest, it's a community involvement. So they have the local clinics come, hospitals that come and will do blood draws for lab work at their health fairs. And so one hospital, they've got a machine where they can go in and check for blocked arteries through a sonogram procedure. So like I said, on that one, it's do what works for you, what works for your employees, but also keep in mind, if you have an annual enrollment, you can still have a health fair maybe in a couple of months, especially if you have that county-specific incentive and you're needing employees to go and get their annual physical. That's a good way to handle both, do both at one time.
Yeah, and I really like, of course, as Kathy mentioned, every group does things differently. So if maybe you don't have an employee population where they are coming in to get the information at a presentation, then maybe come and go style day is your best bet. And again, as Kathy mentioned, just meeting your employees where they are. A lot of times those precinct workers, they don't want to come to the courthouse for a presentation. So if that means that it's us going to them, we're happy to do that. We want to make sure that all of your employees and their dependents, their families, have the information and the tools needed to be able to utilize their benefits. And one thing we've also noticed within presentations before is that the county will invite the employees' families. So if they have a spouse that wants to come in and learn about the benefits so that they understand how to utilize that as well, then they're also invited to those presentations. So just be creative as you go along and you start setting those annual enrollment presentations. You know your employees, you know the culture of your group, and so just kind of tweaking it based off of what's best for you.
Yes, and the one thing that we have, noticed over the years, if you have food, they will come. So keep that in mind too. So quick question, which tool helps you enroll online? Email, phone call, text message, or the ESS portal? Okay, time's almost up. Everybody's answered. Nice. Yes, the ESS portal. And you can still do it because we all know employees that don't like doing the whole technology thing. So, it is a combination, and we'll talk about that in a little bit.
All right, Alan is up.
Yeah.
Alan and Jennifer just
yeah,
switch it.
All right. Do you let your employees make elections online on the employee self-service portal? And this one, there's not a right answer. We're just trying to get an idea on if this is something you may be more interested in. Are you already using it and like it? Because we do share that information with other groups on how, some of you are doing this already, how you're doing it. So
24. Okay, so 24 are not using it, but 11 are. So that also gives you a perspective. If you ever need to see if another group is using it, how their experience is, feel free to ask your benefits consultant or specialist. We're happy to share some ideas and feedback on who is, utilizing it and how they're using that ESS.
And this year I've talked to 2 different groups that have gone to that hybrid. And both groups have said if there is someone who's, another group that is wanting to check into this and maybe implement it, they're more than happy to talk to you and explain, talk you through how they handle it. And like I said, we're always available. All right, next question. Which is a way to finalize elections? Verbal agreement, ESS or paper form, text message, or a phone call? And guys, like I said, don't change your office hours. Don't unplug your phones. So, all right, that's right. You can do it through ESS or paper form. All right, let's see which one. All right.
Hey.
Yeah, Alan's still in the lead.
All right. So in the summertime, SPF is super important, as we know, for our skin. So we want to make sure that you're also protecting your employees from the summer heat. So we gave you a little acronym for some useful resources that you can notify your employees about. So S is for reminding your employees to sign up for the employee self-service portal. Whether they're utilizing that to make their elections or not, it's still a really great resource for them if they have any questions throughout the year on any of their coverages. And then P, of course, within that ESS, they'll have the plan overview and their resources available to them. So there's actually a digital copy of their resource guide available on the ESS. They can also view their benefit highlights, the terms or definitions for what a deductible is, what an out-of-pocket is, etc. And there's also a frequently asked question tab where they have listed questions that have frequently been asked, where they can go in and see the answers to that. And then lastly, whether you're using the ESS portal or not, they can either finalize their elections on there, or they can do so at annual enrollment with the paper form. So if you're still doing that, or if you're doing a combination of both, that's going to be a good opportunity for them to get registered on the ESS, make sure that they're using the preventative things and tools that they have available to them to be informed about their coverage and how to make those elections. So the ESS is important. Make sure that you're reminding them to sign up for that at an annual enrollment, and to make sure that they know of all of the resources available to them. So what we did is we pulled a little screenshot. If you're not familiar with the employee self-service portal, this is what it looks like when employees have finished logging on. They will have a dashboard where they're able to see their 2025, which currently their coverage, and then once they get into the new plan year, they'll see 2026 coverage. So they'll be able to see the cost of that, they'll be able to see the plan name and exactly who, as in which dependents they have covered. They'll also be able to see a link to Navitus. So under both of those, they'll see direct links for each of our vendor partners. So the benefit of that is that they're not having to remember multiple passwords for different portals. Once they have their ESS login information, they can click directly on the Blue Cross link, and that directs them into their portal once they sign in with that one. So it alleviates having to remember all of those passwords for our different vendor partners.
All right.
And then if they click on the My Benefits, then they also have information on the cost breakdown. So again, they can see how much they're paying per month, how much the employer contribution is. Of course, this is just a test employee, so this might not be a true indication of your benefit dashboard, but it's a really great tool for them to go in and see what their benefit cost breakdown is throughout the year.
All right.
And then as I discussed earlier, you'll see resources or a resource library available to employees. So if they go to the frequently asked questions, they have a list of questions dedicated to the enrollment, to the medical or dental plan, whatever resources that you have available to the county. If they have any questions, that's a great place for them to go on first and look for that. It does help your office to alleviate some of those questions that you're getting, because we understand you wear many hats, and so sometimes those questions, it can be a lot.
All right.
All right.
So we know, and like I said, if y'all have had any questions throughout this whole time, and we haven't addressed them, please put them in the chat box. We'll get those answered. But we brought in our two wonderful EBSs because a lot of the times we'll get questions whenever we're out on the road during these presentations from you, the ones who are actually doing this work. And we just want to make sure that y'all, we brought y'all in for this so they hear those answers from the experts. Because, I mean, my groups know a lot of time it's like, hold on, let me get back to you. I need to confirm this before I tell you wrong. So we're going to turn it over to Megan and Haley for this point.
Okay, so for our OASIS admin users, when processing a new hire enrollment, when entering a social security number in OASIS, which format is correct? Yeah, so we see this a lot. This is probably our number one calculation error that comes back. So you want to remember you're just entering the numbers for the SSN. No dashes, just the numbers.
Alan still.
Alan still.
Wow.
All right.
Great job, Alan. For the next question, what do I do when entering a new hire and they show inactive/terminated prior to being in a dual plan year in OASIS? Remember to be quick. That helps with the points also.
Yes.
And for sure, don't panic. I'll give you that one. That's not it. A few more seconds. Good job. So wait for dual plan year to go live to make and save elections on your new hires. So this depends on the waiting period, but if you do have a waiting period that's an extended amount of time that goes into the next plan year, you will have to wait to put those elections in.
All right. Alan's still in the lead and building up a pretty comfortable lead. All right.
When processing a new hire enrollment and the current status shows awaiting elections, will my new hire feed to the carriers?
This could be a tricky one.
I feel like these questions make you think.
Yes. So no, I need to go to participant benefit, make elections, and save. Yeah, if you see that that status is awaiting elections, it is not going to feed to the carriers. So once you've processed and saved your new hire enrollment, you have to then go to make elections and save the elections for the member.
All right.
Let's see, Alan, can you hold the lead?
Wow.
Yeah,
sure
he
can.
still is. All right.
Doing good. so
And
far.
Rebecca's coming back up,
Coming
too.
back up, yeah.
When entering a full-time employee, what is the correct ACA 30-hour eligible response? Can kind of do process of elimination here, so hopefully we'll get it right.
Whenever we were doing these questions and I got to some of the answers and, what's ACA? I'm sorry, I laughed. That stop, drop, and roll was...
So the answer is no. ACA 30-hour eligible is only for part-time employees who are receiving benefits. So if they are full-time, they do not need that.
Okay. And Alan's still in the lead.
All Last question.
What is the correct first step for adding a dependent to an employee's coverage? This one could be a little tricky too. Yeah, so it's going to be C. We're going to run the event with the correct event date. Remember, we're always needing to run an event before we add or drop dependent coverage. If we don't, then and you add the coverage or delete the coverage without running an event first, it's going to go back to your anniversary date. Okay, so let's always remember we're going to need to run the event, and then we can deal with the elections.
Okay. And actually, that was the last question. So we're fixing to find out if Alan kept his lead.
Drum roll.
Yeah.
Drum roll. Third, Sarah. All right, Sarah, not sure where you're from, so make sure you let us know.
Same for Rebecca.
And
First place.
And
Alan.
All right.
Good job.
And it looks like Alan and Rebecca got the same number of questions right.
Uh-huh.
It was just he may have been a little bit quicker on the draw. So congratulations. But like I said, you know what we've been saying, make sure we have your information in the chat box. We have your name, what county you're from, and we will get your prizes to you.
And okay, Rebecca B is from Aransas County. Alan is from Lampasas, and then I know that we still had a few questions in the chat box. One of those being
I'm gonna close this out.
the ESS and when that opens throughout the year for open enrollment. That date is going to be listed on the calendar that I believe is in the open enrollment toolkit. So you'll want to make sure, I know that our 10-1s, if you've submitted your renewal, you have already received your annual enrollment toolkit. So you'll want to make sure to check out that calendar to find the window of dates for when that when the ESS opens.
Yes. Yeah. And if you were a little late getting your renewal in, depending on how late it was coming in, that may, what they say, shorten that window a little bit, being able to enter those changes.
And we've also included some documents in the chat box. So this is kind of takeaway a toolkit for you to find different resources such as an annual enrollment flyer if you need that to send out to your employees. We've got the calendars, of course, in your toolkit, but lots of great resources that you're able to download for some of those frequently asked questions that you might have. Another question that we had was, do we have access to a digital version of the resource guide that we can send out to our employees? Yes, absolutely. Please feel free to reach out to your EBS or EBC. We can compress a version for you so that we can send it via email and you can send that out to your employees. Also, just a reminder, they do have access to that resource guide on their ESS. So you don't necessarily have to post it anywhere. You can notify your employees that they do have access to that via the ESS if needed.
Yes. And Emery, if you'll just let us know what county you're with, we will make sure that your employee benefits consultant does reach out to you, okay?
Okay.
All right. And evidently it's me. Thank you, Judge Irwin, for that information. And yes, I will definitely be reaching out.
Yes, great. All right. Any other questions? Did anyone have anything else?
Like I said, now's the time to pick our EBCs and EBSs, their brains. That's what we're here for.
Absolutely. And Sharon did just put in the chat box, the ESS window will be open from August 19th through the 29th for annual enrollment for our 10-1 groups. I know a bulk of our groups are 10-1, so keep those dates in mind. And then if you have other anniversary dates like 11, 12, or a 1-1 anniversary date, You will be receiving your annual enrollment toolkit, and you'll find those dates available in that, or you can reach out to your EBC or EBS about that.
All right.
All right.
Y'all aren't asking us any questions, so y'all are very good at what you do, evidently. And we haven't evidently we have not confused you. So guys, just remember we are always available. You have our phone numbers. You should have our emails. You also have our cell phone numbers. Reach out to us at any time, and we'll help you with what we can. And if y'all don't have any questions from us, we can let y'all get back to your real jobs instead of having fun with us. So, like I said, just holler out at us if you need something. And Emery, I will be seeing you soon.
And Desiree will make sure to get you the prize for the last time. Thank you all so much. Y'all have a great rest of your week.